It is now my pleasure to introduce my friend and colleague, Dr. Thor Halfdanarson. Dr. Halfdanarson has a very interesting history. He has a degree in physics from Reykjavik College. He then went on to have a MD degree from the Faculty of Medicine at the University of Iceland, and then did internships and residencies in more disciplines than I can count, before settling eventually on oncology as his career, where he did his training at Mayo Clinic in Rochester, then went to Iowa, saw the light about the cold and came to Arizona, and he was with us for several years, and then had a hankering for those frigid temperatures of back home and has rejoined the faculty of Mayo Clinic in Rochester. But we don't have any problem persuading Dr. Halfdanarson to return to see us in November to participate in our course. So welcome, Thor. He's going to talk about pulmonary neuroendocrine tumors.
Thank you. Thanks for the kind introduction. Yes, my wife told me that 12 years of postgraduate residency and fellowship was enough, and there was time to stop. So if you came here to listen to a lecture on randomized clinical data, you can go back to sleep, because I will not present that. This is really, in terms of high quality data, it's a little bit of a data-free zone, if you will. So these are my disclosures. So this is the outline of the talk. So neuroendocrine tumors can arise anywhere in the body, thought to come from the cells of the neuroendocrine system, which is dispersed throughout the body. And the neuroendocrine tumors in the lungs are very heterogeneous. So they range from typical carcinoids, which I will talk to you about, up to small cell and large cell carcinoma, which I will not talk about today. So unlike NETs otherwise in the body, the term carcinoid is still alive and well in the chest. We have gotten rid of the term carcinoid from all other neuroendocrine tumors. Hasn't been in any of the diagnostic criteria for example, bowel carcinoid. Although people talk about carcinoid tumors all the time, we have eliminated the term from the WHO classification. But in the chest, it's alive. So as for the epidemiology, so lung NETs account for about 20 to 30% of all neuroendocrine tumors, and up to 5% of all lung cancers are NETs. Depends on what you count as a NET. So if you count small cell, it's as high as 20% sure. And this is the most common lung cancer in children and young people. And the median age of diagnosis is 45 years, and the incidence is rising, possibly in part due to more scans being done. So if you look at this graph here, this is from a recently published paper on neuroendocrine tumors in general. So the top blue line here is all cancers as per the SEER registry, as we can see, going from 1973 to 2012. There was a little bit of an increase in the incidence of cancers